Are you going to be able to visit family this Thanksgiving? Are social bubbles obsolete? Those are some of the questions asked today during the Premier's news conference. I'll have the answers in a moment, but first, his announcement. Changes are coming to visitors at long-term care, as well as $500 million in new funding.
We have to take action now to protect those we care about most.
The first wave exposed cracks in long-term care that have been building for decades. 1,800 residents died when COVID swept through homes, and frontline workers were understaffed and overwhelmed. The government today announced it's investing $540 million to address proper ventilation, infection control, PPE, and new hiring.
We're now into the second wave. Why didn't you try and recruit people weeks ago?
We saw these cases take off, as I always say, like an Australian bushfire at the beginning. Then all of a sudden we saw a decline.
Another devastating consequence of COVID was the no visitor policy, which left long-term care residents isolated and families devastated.
There's more bad days now than good days. She's just so lonely. She's so very lonely.
Visitors have since been allowed in under strict conditions, but now the Ford government is changing the rules. As of this Monday, in hot zones, visitation will be restricted to staff, essential visitors, and caregivers.
We have made it possible for family members or friends to come in as caregivers. This kind of support is critical, and I encourage family members, friends, please sign up to be a caregiver.
And while today's COVID count was down to 554 from yesterday's all-time high of 700, hospitalizations continue to rise. There are currently 137 COVID patients in hospital, an increase of 51 in the past 5 days. The medical director of critical care at Michael Garron Hospital posted this video on Twitter right after today's news conference.
I'm shocked and disappointed. I didn't hear anything about interventions that will be designed to reduce the risk of COVID-19 further spreading out of control in our province.
As for social bubbles, the day after Toronto's medical officer of health advised people to limit their social interactions to those in their homes, there was no clear guidance from the province. However, the chief medical officer of health did say they may be asking people to limit the number of family members for Thanksgiving, adding to cook the turkey well.